Today's topic is about cytomegalovirus infection. So, cytomegalovirus infection is the most common congenital infection, affecting around 3 to 4 out of 1,000 live births in the UK. And the mode of transmission are transplacental, which is from the mother to the fetus, or it can be transmitted through oral or genital, through the salivary or genital secretions, through blood transfusion, organ transplantation, and also breastfeeding. The clinical features are different for several age groups. For infants that are infected, 90% are normal at birth and they develop normally, whereas 5% of those who are infected with cytomegalovirus will have clinical features at birth. They might present with mononucleosis syndrome, with pharyngitis and lymphadenopathy. So you might be thinking, what is this mononucleosis syndrome? So it is also known as infectious mononucleosis, which is a common viral infection that typically causes fever, pharyngitis, and lymphadenopathy in young patients. However, the most common organism is Epstein-Barr virus, but this cytomegalovirus can also cause it with similar presentations as the Epstein-Barr virus infection. And other clinical features seen in infants are petechiae and purpura. Some may present with hepatosplenomegaly, which means enlargement of the liver and spleen, hepatitis, jaundice, and also thrombocytopenia. There are also some that present with neurodevelopmental disabilities, for example, sensory neural hearing loss, cerebral palsy, epilepsy, or cognitive impairment, developmental delay, and also mental retardation. Small for gestational age is also one of the clinical features, and there is one characteristic appearance shown in this picture over here, which is the blueberry muffin appearance. So this blueberry muffin is the descriptive term used when the infant is born with multiple blue or purple marks on the skin. This happens due to the presence of clusters of blood-producing cells in the skin, also termed as extramedullary erythropoiesis. So other age groups that can be infected with cytomegalovirus are in pregnant women, where they are usually asymptomatic or only present with mild symptoms, and also immunocompromised people. They may present with retinitis, pneumonitis, bone marrow failure, encephalitis affecting the brain, hepatitis affecting the liver, colitis affecting the gastrointestinal tract, and also esophagitis. So the investigations that can be done for cytomegalovirus infection are peripheral blood film, where we expect to see atypical lymphocytes. Monospot test, if negative, indicates the absence of heterophile antibodies. Heterophile antibodies are those antibodies induced by external antigens. So we can also do viral isolation from urine or saliva. This is a diagnostic test, and it must be taken within the first 3 weeks after birth, where we do rapid culture using centrifugation and monoclonal antibody, and the result we can get it within 24 hours. We can also do serology to look for strong IgM anti-cytomegalovirus antibody titer, and also polymerase chain reaction to detect for cytomegalovirus DNA in the urine. For treatment, there are antiviral medications, which are ganciclovir and foscarnet. That's all for my presentation. Thank you.